My name is Lance Martin. I am a family medicine doctor in Seminole, Texas. Well, I wanted to come back to a small town. I'm from a small town, Sudan, Texas, which is about 90 miles north of here, and I grew up on a farm there. So I wanted to return to a small town and be a doctor, and there's biggest need is for primary care. And so I wanted to be just a regular small town doctor, and that's the way to do it. It's family practice with OB. I had a doctor when I was a kid that was a small town guy, and he just seemed to know everything about everybody, and I wanted to be that guy. That's what I did. The real reason I became a doctor is to help people and just to make a difference in people's lives, and hopefully we help some people. I went to Texas Tech for undergrad, I went to Texas Tech for medical school, and I stayed there for residency. So I was at Tech for 11 years. I lived in Lubbock most of the time. I lived in Amarillo for about a year. You know, anything that can be cured with diet and exercise, we try to cure with diet and exercise. And if we need to go on pills, we go on them, but we try, you know, like a natural, you know, almost homeopathic approach first, and then if we need to move on to something else, we do it. We have a girl over to the side that checks you in, does all your paperwork, does all the prescriptions, and I just come in and I sit across from my patient and talk to them because I don't want to be distracted. I want to be in the moment with the patient, talking, not typing. And I don't want to be sitting down writing or typing. I want to be talking to the patient and fully engaged. And I think that's the way it should be for everyone. It just depends. We have a wide range. We're open Monday through Friday. We usually go 8 to 5. Sometimes we shut down a little early on Friday if we finish early. But we stay every time until all the patients are seen. So the key thing is you can get in any time to our clinic, and there's no restrictions on numbers. So sometimes we see 50, sometimes we see 10. But we're going to stay until everyone is seen and taken care of. The one thing that would make my clinic, I think, sets us apart from other places and, you know, from going to the bigger towns, is that if you come into our clinic and we get to know you, we take good care of you. If your kids are sick on the weekend or on holidays, you can call us and we'll make sure you're taken care of. It's more of like a family atmosphere. All the girls that work there will know who you are and who your kids are, and you won't just be another file or another face. The main thing is that my wife works there, and it's a family atmosphere. We want people to be taken care of.